Hey everyone, it's Moy. Today let's delve into the art of massaging the rhomboid muscles for ultimate relaxation and relief. But first, let's understand their anatomy. The rhomboid major originates from the spinous process of the thoracic spine T2 through T5, attaching along the medial border of the scapula. Its counterpart, the rhomboid minor, originates from the vertebrae C7 and T1, inserting into the root of the scapula spine. Together, they stabilize the scapula and assist in retraction of the shoulder blades. Imagine pinching them together. Before we begin, let's establish a comfortable connection. Ask your patient to take a deep breath, allowing their ribcage to expand until it gently touches your hands. This simple gesture sets an inviting and elegant tone to the session. Now let's address the elephant in the room: cold hands. We've all been there, hearing those dreaded words, "Your hands are too cold." But fear not, there are two simple solutions. First, wash your hands with warm or hot water before the session, and second, rub your hands together before entering the room to maintain the warmth. Let's face it, nobody enjoys vigorous hand rubbing while laying face down. It's a little off-putting, right? Rant over. Let's dive into the task at hand and dive into our session. For our first technique, let's focus on the detail often overlooked by many therapists. When performing cross fiber with your fingertips, it's essential to ensure that you have more than one point of contact. After pushing on the skin, lift your fingers and observe the white spots left behind. These indicate the points of contact. More often than not, the middle finger tends to dominate due to its length. To address this, bend the middle finger slightly, creating 3 points of contact instead of 1. This adjustment provides a broader and more comprehensive approach to the massage, minimizing strain on the middle finger while maximizing effectiveness. It's a small tweak with a significant impact. Technically speaking, since the rhomboid fibers run down at a 45-degree angle, cross-fiber massage should be performed superior to inferior. The same principles apply here. Personally, I prefer using a triangular shape with my fingertips to ensure 3 points of contact, maximizing effectiveness. However, due to the width of the muscle, only one hand can be actively engaged while the other one serves a supporting role. In my approach, I opt for a slightly more rigorous technique, incorporating a gentle swaying of the body for enhancing effectiveness and overall massage experience. It's crucial to adjust the speed of the massage due to both your own and your patient's preferences for optimal comfort and results. Now let's focus on what I like to call the moneymaker technique. While we all love helping our clients, this particular technique often keeps them coming back for more. Nearly 99% of patients complain about tension between the shoulder blades, making this technique invaluable. Mastering deep stripping is key here. It's crucial to adjust the table for maximum depth. Gentle bendings of the thumb can provide extra depth without compromising comfort. Remember to load the muscles of the thumb, not the structures, and aim to get as close to the spine as possible before moving laterally to make contact with the scapula. Ensure thorough coverage of both rhomboids, major and minor. For cross-fiber stripping, focus more vertically and hug the edge of the scapula to target those insertion points effectively. The same principle applies for both the spine and the origin of the muscles. Before beginning the stroke, ensure you have adequate depth, as the rhomboid muscles lies deep to the trapezius. Additionally, keeping the arm straight is crucial for the effectiveness of this technique. While you're likely aware, it's always a good reminder to appropriately warm up the area before applying deep pressure. This helps prepare the muscles and tissues for the intensity of the massage. If you're ready to take your deep work to the next level, keep watching. Guide the patient's arm behind the back, ensuring their comfort throughout the process. Should any discomfort arise at the glenohumeral joint, simply place a bolster under the elbow or shoulder for added support. This position induces internal rotation of the arm, deliberately causing scapular winging. This unique angle allows for deeper access to the insertion points reaching beneath the scapula. Incorporate this movement seamlessly into your massage style, finding an elegant way to position the arm behind the back. The same principles apply as before, whether you're using thumbs for lateral or vertical stripping or employing 3 points of contact with your fingers. Remember, not everybody's scapula has the same mobility, so avoid forcing anything. Treat each body with care and apply deliberate pressure. Never adopt a seek and destroy mentality. This approach can feel forced and uneasy for the patient, highlighting the importance of knowing your anatomy thoroughly. Patients typically love this technique. Now, let's add a little traction to the scapula. From the same side of the scapula, grip it almost like a rock climbing hold. Lift up and away, holding it for a few seconds before repeating. If your patient has the room, feel free to incorporate some cross fiber work on those insertions. I jokingly call this one scapular finger fiesta. Or do I? Let's keep that between us. Moving on. Now, let's move on to what is probably my favorite technique in this video. It's surprising how often therapists overlook incorporating mobility into their routines, but here's the truth. Don't settle for a one-size-fits-all approach in your massage practice, trust me. It's obvious when you copy and paste. Instead, tailor your techniques to each individual client's needs. For instance, this patient frequently complains about chronic stiffness around the scapula, so I ensure to adopt a 3-dimensional approach to address their specific concerns. To begin, I lift and cup the shoulder, providing a support to the bicep region with the arm. The goal here is to create a movement by gently pushing and pulling the scapula. With the other hand, I gradually work my way under the scapula using a C-shaped motion to meet my fingers with the thumb at the inferior angle. Establishing a rhythmic pattern is key, so take your time to find your own unique vibe. This technique can be executed with the arm either straight or behind the back. Remember, always prioritize the comfort of your client above all else. This next technique requires clear and precise communication with your patient. Whenever your body makes contact with theirs, aside from your hands or elbows, it's crucial to inform them what you're doing and ensure their comfort level. Remind them it's okay to speak up if they feel uncomfortable at any point. Nothing is mandatory. Now let's continue with enhancing shoulder mobility. Begin by lifting the arm high enough to drape the bicep across your thigh, ensuring that the crease of the leg aligns with the head of the table. From here, gently push and pull the scapula, exploring various movements. Use your left hand to provide support to the head of the shoulder while your thumb explores the latissimus dorsi and posterior deltoid muscle. Exercise caution to prevent excessive swinging of the arm, especially given to its proximity to your inner thigh. I always encourage sessions where the patient has some involvement. It's only fair, right? Let's incorporate an active stroke with 2 variations. For the first variation, position the patient's arm off the table and apply acute pressure with both thumbs right at the origin of the rhomboids. Instruct the patient to perform internal and external rotation, focusing on engaging the muscles between the spine and the scapula, aka the rhomboids, particularly during external rotation. Now, for the second variation, instruct the patient to fully retract the scapula while keeping their arm completely straight. Apply pressure and guide them to adduct the arm. Unfortunately, I forgot to film this part, but for a more lengthening approach, have them bring the arm over the head of the table so the arm hangs freely. It's important to know that this technique may be challenging for those with poor upper back muscle strength, so move cautiously and kindly. And finally, for those of you who stuck around until the end, here's a little bonus technique for you. Apply a couple of cups to the rhomboids. Instruct your patient to externally rotate the shoulder and press their arm overhead, similar to a shoulder press exercise. Allow them to move at their own pace, and when they're ready, prompt them to retract their shoulder blades for a set number of repetitions. I typically instruct them to do anywhere between 5 to 10 reps. This empowers the patient by giving them some control over the session. As we wrap up this video, I want to thank you for joining me on the journey into the world of massaging the rhomboids. While there's a plethora of information out there, we have to bring this session to a close. Stay tuned for part 2 in the future. If you found anything in this video helpful and feel like I've earned your subscription, that'll absolutely mean the world to me. And hey, while you're at it, go ahead and hit the like button for me. That'll be really helpful. For real. Thanks. Remember, massage is all about curiosity and creativity. I'm not here to dictate what you should do, but rather offer you a myriad of examples of what you could do. Let's start a dialogue about massage. Let's talk techniques, tips, and tricks. Sending you all much love and good vibes. And as they say, just like a knot in a muscle, let's untangle life's tensions together. Peace out.